Here's a USMLE style question focused on coronary angiography and percutaneous coronary intervention, PCI. USMLE question on coronary angiography and percutaneous coronary intervention, PCI. A 65-year-old man with a history of diabetes, hypertension, and hyperlipidemia presents to the emergency department with chest pain that started 2 hours ago. The pain is substernal, radiates to his left arm, and is associated with diaphoresis. An ECG shows ST segment elevation in leads 2, 3, and AVF, consistent with an inferior myocardial infarction. Given his symptoms and ECG findings, the decision is made to proceed with coronary angiography. Question: which of the following is the most likely indication for performing percutaneous coronary intervention, PCI, in this patient after coronary angiography? Option A: mild coronary artery stenosis, 50 to 70%. Option B: acute non-ST elevation myocardial infarction, NSTMI. Option C: total occlusion of a coronary artery with ST segment elevation. Option D: left main coronary artery stenosis, 70%. Option E: asymptomatic coronary artery disease detected on routine screening. The correct answer is option C: total occlusion of a coronary artery with ST segment elevation. Explanation: coronary angiography is performed to visualize the coronary arteries and determine the extent of disease. In the setting of an acute ST segment elevation myocardial infarction, STEMI, the goal is to identify the culprit artery responsible for the infarction and perform percutaneous coronary intervention, PCI, to restore blood flow. Option C: in the case of ST segment elevation, PCI is the standard of care for restoring flow in the occluded coronary artery, especially if the occlusion is complete and causes an acute infarction. Early intervention improves survival rates and minimizes myocardial damage. Option A: mild coronary artery stenosis, 50% to 70%, typically does not require PCI unless it is symptomatic or associated with other risk factors. Option B: PCI may also be used in STEMI, but the decision depends on factors such as clinical presentation and non-invasive testing. In this case, the patient has ST segment elevation, which calls for more urgent PCI. Option D: left main coronary artery stenosis, greater than 70%, is a critical condition, but PCI in this location often depends on the anatomy and patient's overall health. Surgical intervention, CABG, is often preferred for left main disease. Option E: asymptomatic coronary artery disease detected on screening does not warrant PCI unless significant stenosis, 70%, is present in a symptomatic patient. In this patient's case, the total occlusion of the coronary artery with ST segment elevation indicates a STEMI, for which PCI is the recommended intervention. Early restoration of blood flow to the infarcted area reduces the risk of further damage and improves patient outcomes. Thank you for listening.